according to the American Society of Reproductive Medicine, they have come up with the latest guidelines on March 30th that all non-urgent fertility procedures should be postponed in view of coronavirus. This is because it's best for the patient's interest, because fertility treatment requires multiple visits to the clinic for their workup, for their hormonal profile, for their ovulation studies, and coming to and back to the clinic will expose them to the risk of the coronavirus. They'll be traveling the same elevators, sitting in the waiting rooms with the other patients, and it's not suggested at this point. All non-urgent conditions, like they have put it very clearly, like urgent conditions, if somebody is having medical reasons, strong medical reasons, like if somebody is getting some chemotherapy or radiotherapy for medical concern, in those cases egg preservation, sperm preservation and all that is allowed. Otherwise, I think it's best to postpone it for a while. It is not like it's putting a stop to it. It's just like taking a little break, a pause, and then we can start it once the curves flatter down. For infertile patients, even a week counts, month count, and it's a very stressful condition. Getting a treatment for infertility, and on top of it with this new coronavirus coming up, the stress level is already doubled up. But right now it is best to postpone the treatment. It is in the best of their interest, because the exposure of getting corona outweighs all the benefits of getting fertility treatment at this point. So all elective procedure, all non-urgent fertility treatment should be postponed. We are trying to decrease the number of the visits to the clinics. So there are certain tests which are very, very important. Like one is a dating scan at 7 weeks, just to find it out the cardiac activity of the fetus. And 13-week scan, especially if the woman is above age 35, it is very important to rule out Down syndrome and other anomalies in that. So that's one important scan, but we try to schedule everything together, like whatever the blood tests are required, in 8 or 9 weeks or around 15 weeks, their BP, everything in one visit. We don't call them multiple times. 13-week scan and anomaly scan are two very important scans that they should not miss, but they should club it out with others. Rest, most of their concerns we are promoting, like they should be doing telemedications, and in case any concern is there, they should be calling us for minor aches and pains. So they should keep account of the baby movements if they are in the later trimester. But definitely anomaly scan and anti-scan are two important scans which they should not miss. But till today, there is no proof that keeping a moist mouth will prevent you from getting a corona infection. It is an airborne disease, so you have to use all those precautions. And whether they want to fast or not, that will be based on their medical conditions. If she's not diabetic and in healthy condition, depending upon what trimester it is, we can guide them on that. Every pregnancy is different. If the lady is having a lot of nausea, vomiting and other medical concerns, then the routine then she has to avoid. There is no correlation between moist mouth and prevention of the corona. Right now, there is no proof that there is increased risk. They have done a number of studies, because this is something very new and not much studies are available. But whatever literature and whatever experience we have, it is showing that there is not an increased risk of miscarriage. We are keeping them in labor and delivery unit only, but in a separate room. So routine airborne precautions are used, and they're allowed to deliver. Normally, there is no contraindication. The baby is given to the mother, and she has to use all the airborne precautions. Breastfeeding is recommended because it's good for the baby. And only thing is that she has to use the general precautions of hand washing and all those airborne precautions, using a mask and all. Otherwise, if she's not fit enough to breastfeed and she's feeling sick and she wants to pump and give it to the baby, then she has to be very particular about the hygiene of that breast pump, and it should be exclusively used. But as such, the baby is not separated from the mother. There is no transmission from the breast milk.